Hello friend, welcome to our channel. Today we are discussing about atherosclerosis. It is very important topic for the Neet, or it is very important for the heart. Atherosclerosis is the word derived from the Greek word athero meaning gruel and pest, or sclerosis means hardness. Pest hardness is the meaning or is hardening of arteries. The most common cause of heart disease is atherosclerosis, in which fatty deposits are formed in the arteries, which may cause blockage in the arteries, which lead to the MI, myocardial infarction, which is the heart attack. Content in the lecture is Introduction to Atherosclerosis and etiology of atherosclerosis, epidemiology, pathogenesis, complication of atherosclerosis, general consideration of management, what to require for this disease. Introduction to atherosclerosis. Atherosclerosis is known as the vascular disease, arteriovascular disease, the condition in which artery wall thick as a result of build of fatty material such as cholesterol affecting the arterial blood vessels and chronic inflammatory response in the wall of arteries. There is a blockade of arteries caused by the fatty material deposit in them, which may cause stop blood supply of the artery due to the accumulation of macrophage white blood cells and promoted by the low density lipoprotein called as a LDP without adequate removal of fat and cholesterol from the macrophage by the high density lipoprotein. This causes atherosclerosis. This is a normal artery. This is tunica intima. This is tunica adventitia. This is tunica media. Tunica intima is an endothelial that line the lumen of the vessel. At that lumen, there is a formation of fatty deposit occurs. Tunica adventitia is the collagen fiber membrane which protect the artery, and tunica media is a smooth muscular cell or elastic fiber which give elasticity to the arteries. This is all about artery. This is the fatty droplets which accumulate in the inner lumen of the arteries, which cause blockade in the artery or which may directly cause atherosclerosis. These are the RBCs. This is the normal artery and this is the fatty deposited artery which may cause atherosclerosis, and this is called as a atherosclerotic plaque. Artery narrow because of this plaque and this cause blockade of the blood. IMP terms in the atherosclerosis. This is arteriosclerosis is a general term describing any hardening or loss of elasticity by the arteries. Atherosclerosis is the hardening or loss of elasticity of arterioles, small arteries. Atherosclerosis is the hardening of artery especially due to an erythematous plaque. Atherogenic is used for substance or process that cause atherosclerosis. Atherogenesis is the development process of atheromatous plaque. Etiology of atherosclerosis. Atherosclerosis starts in a damage and injury to the inner layer of the arteries. Damage may caused by high blood pressure, which is from the heart, pumping of left ventricle, which cause high blood pressure, high cholesterol in the body, which caused by the junky foods, an irritant such as nicotine, certain disease such as diabetes. These are directly affect the atherosclerosis. Epidemiology. What is epidemiology? Epidemiology is the study, scientific, systematic and data driven, the distribution, frequency, patterns and determinants, cause, risk factor of health related states and events, not just diseases. It specify population, neighborhood, school, city, state, country and globe. This is all about statistics of that disease, in which how many countries it occurs, how many percent of genders affected by it. Atherosclerosis is the less prevalent in the Central and South America, Africa and Asia, most prevalent in the United States and Japan. In US and Japan, atherosclerosis is common. Mortality in US in United States is 5 times higher than Japan. Because of our day-to-day lifestyle, there is more chances to form fatty deposits in our arteries because of our diet, which is mainly composed of junk food. According to the US state data for the year 2004, there are more about 65% of men and 47% of women. The first symptoms of atherosclerotic cardiovascular disease is a heart attack, sudden cardiac death within an hour of onset of the symptom. This is very dangerous, that atherosclerosis directly cause death of the person. Pathogenesis. The following are the steps involved in the hypothesis. Chronic endothelial injury from the inner lumen of artery, accumulation of lipoprotein in the place of injury, monocyte adhesion to the endothelium, monocytes or large cell attached to that site, SMC proliferation and EMC production, factor release, various factors are released, platelet adhesion, platelet also bind to that site. Manifestation and symptoms of that disease is atherosclerosis symptoms depend upon the arteries are affected. For example, atherosclerosis in the heart artery, which directly affect the oxygen supply to the heart, which may cause stop the functioning of the heart. Atherosclerosis in the arteries leading to brain, which may cause brain damage or leading to the stroke of the brain, which is very dangerous. The brain is very delicate organ in the human body. Atherosclerosis in the arteries of arm and leg, which directly block the blood supply to the arm and legs. Erectile dysfunctioning. Complication of the atherosclerosis. The complication of the atherosclerosis depend upon the location of blocked arteries. For example, coronary artery disease, which directly affect the heart. These are the arteries that are blocked on the heart, which supply blood to the heart. Carotid artery disease, which are present in the leg. Peripheral artery disease or aneurysm. Test and diagnosis of atherosclerosis. Doctor may find sign of narrow, enlarged, hardened arteries during the physical exam. This includes the weak and absent pulse below the narrow area of the arteries, which is detected by the ECG electrocardiogram. Decreased blood pressure in the affected limb, which may cause lodged of the arm. Washing sounds over the arteries heard with a stethoscope. Sign of pulsing bulge, aneurysm in the abdomen or the behind knees. Evidence of poor wound healing in the area where the blood flow is restricted. Depending upon the result of physical exam, doctor may suggest that one more diagnostic test including blood test, which include mini test, Doppler ultrasound, 2D echo, ankle brachial index, other imaging test. Angioplasty also include angiogram, electrocardiogram, ECG also include. General consideration of the atherosclerosis is lifestyle and home remedies. Lifestyle change can help prevent and slow the progression of atherosclerosis by stop smoking. Smoking is directly proportional to the formation of atherosclerotic plaque in the arteries. Exercise must day for a week. Eat healthy food. Manage stress. Stress management is very important. Manage the condition of high cholesterol, high blood pressure, diabetes and other chronic diseases. Treatment and drugs. Various drugs are slow. Sometimes even reverse affect the atherosclerosis, and some common choices: cholesterol medications, antiplatelet medication, anticoagulants, like heparin, blood pressure medications, and other medications. Prevention, healthy lifestyle is very important. If not treated by the medication, angioplasty, adrenectomy, thrombolytic therapies, and bypass surgeries are conducted by the doctor. Conclusion: although atherosclerosis is considered as a heart disease as it is happen in any part of the body, in arm, in heart, in knees, atherosclerosis can be prevented by the lifestyle factors and home remedies by eating healthy diet, by stop smoking, daily exercise, eating food healthy, stress management, other high blood pressure management, diabetes management, and other high cholesterol management are also included in this. Atherosclerosis is preventable and treatable condition. This is today's lecture. Atherosclerosis is common in US because the lifestyle of the people is very steady, because they do not exercise, they eat junk food. That's why the atherosclerosis is common in them. Indian peoples do not suffer from atherosclerosis at that level, is not, because our lifestyle is very flexible. As we are doing exercise, our diet is very natural. These factors are responsible for our healthy lifestyles. So thank you for watching. This is today lecture. Like, subscribe and share. Thank you.